What are the typical features of CCHS that can happen to affected individuals? CCHS is lifelong and life-threatening. Multiple systems of the body are affected in CCHS, meaning that the management of these patients should happen under specialist multidisciplinary teams that can coordinate with each other for their different clinical specialties. The most important and most immediately life-threatening of these medical features is the underbreathing, the hypoventilation. And that's particularly important during sleep and during times when there is an abnormal lack of response to the levels of dissolved gases, carbon dioxide and oxygen in the blood. We also know that development of the brain can be affected, especially in children with poorly managed abnormal breathing, as well as seizures in CCHS. Several other systems of the body are affected, and the theme that ties all these together is that they're all related to the autonomic nervous system that controls the automatic functions of the body. The heart can have abnormally long pauses in between beats. This is called cardiac asystole. And in certain cases, you'll need a pacemaker installed to compensate for that. The gut can have an abnormal lack of nerve endings. The gut normally squeezes through stool, and that's how the passage of stool happens through the digestive system. If that doesn't happen, there can be a buildup of stool, and that requires surgical intervention. That complication is called Hirschsprung's disease. There is also a particular type of tumor that is at higher risk in these individuals, and those are derived from neural crest cells. An example of this is a neuroblastoma. The eye is also part of the autonomic nervous system, and there can be an improper response to the light on the pupil. You may need protective eyewear for this. There can also be abnormal body temperature regulation and sweating in CCHS.